Ghana's health delivery system is reputed to be one of the most affordable in the sub-region. Yet, it is necessary to underscore that it is not without its peculiar systemic and administrative challenges. Of late, one of the biggest problems militating against healthcare in the country is the influx of fake and counterfeit drugs. From mobile drug hawking to licensed chemical and pharmaceutical shops, the counterfeit drugs have permeated almost all facets of the nation's conventional healthcare institutions.
Mostly, no, I be like Susundro, no, also Onuma, to me, a Juma fine. Ella, a bibidrobi Sukaho, also Numa, and almost all day I catch her then, and no. So Unuma, and so to me friends pa a boy a driver for no. But 2 months out to meet us was there and so fine. To meet us. And a pure home but talk, Mamma Sam to me, because I drop back to me say, I say 20. And then I can say, to me say, I say 2 or 3. And a fine thing will be out me, can't 20 or do maybe and yet.
Head of Drugs Post-Marketing Surveillance of the Food and Drugs Board, Thomas Amedro, tells TV Africa News that though the regulatory authority has gone to great lengths to ensure the safety of consumers, the board is constrained in its efforts due to several factors.
Those who are dealing in medicines, they are supposed to source it from accredited premises and from accredited dealers. That way we will be able to limit the incidents as much as possible, and even if they do occur, we can trace it to the source so that we can take adequate measures to prevent further occurrences of such incidences. When we talk about counterfeit and fake medicines, it's a threat to public health worldwide. It is not something that is limited to Ghana only. It is a global issue, even affecting the developing and then developed countries alike. But for us especially, because of the level of illiteracy, it is particularly more dangerous because people cannot even tell. Some people cannot read, cannot visually detect the fake from the genuine medicines.
As most of these counterfeit drugs gain entry into the country through the nation's porous entry points, it places responsibility on border officials to arrest the traffickers. Speaking to TV Africa News, Assistant Commissioner of Imports and Exports at the Customs, Excise and Preventive Service, SEPS, says the public has a greater role to play since the service cannot guarantee the security of all entry points because the service lacks adequate logistics.
We already played a major role in this area of protecting our borders so that the counterfeit products will not come in. But the issue is not as simple as we see. How do we make a difference between a genuine product and a counterfeit product? It's not as easy as that you can pick the product, immediately determine that it's counterfeit. No, it requires some expertise. But the primary responsibility lies on Food and Drugs Board and Standard Boards. But where they are insufficient, about instead of personnel and logistics, we supplement these areas. So we need backing in terms of logistics, personnel, training, and equipment for us to on the spot determine which is counterfeit or not. Otherwise, our battle will be fruitless.